rupture. Or perhaps it is actually important to mention that the fibrous cap, the plaque with a fibrous cap, plaque, will actually, like a stable plaque that is stable, will result in pathologies such as angina, and a bit of ischemia. That is obviously relieved. Say, for example, like obviously relieved when one stops exercising, or if one was to take the nitric spray, the glycol nitric spray, which is usually delivered under the tongue. So, you know, a person can function and live with stable angina that is controlled, that is being treated. However, if the plaque ruptures, there is a potential for a thrombus to form there, and the rupturing of the plaque also releases all of that material that is inside the foam cells, causing occlusion, really, more inflammation and occlusion, or indeed causing a thrombus, which can, well, or perhaps just a blood clot, which will again occlude the lumen, or indeed become a thrombus. And say for example, if it was at the carotids and the thrombus was to migrate, it will go into the brain and cause a stroke in the brain. Or if it was, say, anywhere else, or even still at the carotids or in the brain itself, if it occludes, then we'll have a stroke. Or if it occludes on the coronary arteries themselves, the patient will have an MI. And if that is not contained within fairly soon, because this is obviously an emergency, it's an acute coronary syndrome. If that is not contained, then there is a high likelihood that the patient will die. So when the plaque ruptures, we have unstable angina, MI, strokes, all of which are acute and medical emergencies. And really, that is how atherosclerosis can cause serious problems in life. So in this section, I have covered what atherosclerosis is, that it is a disease of the intima, of the vessels, that it is a progressive, non-static process that is caused by underlying inflammation arising from the high accumulation of LDL in the vessels. The most important thing to remember is that when there are turbulence in the vessel, it will cause the shearing of the cells, and that shearing of the cells stops the production of superoxide dismutase, which destroys reactive oxygen species. And as we have when we have a lot of reactive oxygen species, it oxidizes LDL. LDL causes LDL to behave like an inflammatory cytokine, and therefore be taken up. As it is taken up into the endothelium, it causes it then causes inflammatory process to occur. It will be taken up by macrophages, and that process then propagates more inflammation via macrophages, secreting even more cytokines to recruit more inflammatory cells, including monocytes and leukocytes, which then use binding sites on the endothelium, such as the ICAMs and VCAMs. Again, reactive oxygen species will cause an enhanced decay of nitric oxide and reduce all the protective mechanisms of the vessel. Another important point to mention is that LDL has ApoB100, which binds onto the LDL receptors on the endothelium. And this process, the binding of LDL to the endothelium, is a natural process, is a process that we actually need, because we do need cholesterol to be delivered into the cells so that we can use it to make things like hormones. However, oxidized LDL is a problem, or glycated LDL is a problem, or a high amount of LDL, as in when people have dyslipidemia, is a problem, which causes the underlying inflammation. So the people who are at a high risk of developing atherosclerosis are people who smoke, men, older people, women who are, well, menopausal women and postmenopausal women, and people with diabetes, and people with hypertension, and people who have relatives who have died from a coronary artery disease. For example, if one has a relative who is a female, a first generation relative who is a female who died at 55 years or developed coronary artery disease before the age of 55, then that makes them at a higher risk, or 65 years old for males. Another one is genetics. Well, genetics obviously links into family history. Another one is, well, things like obesity and exercise are also risk factors that are disputed a bit. And then the complications of atherosclerosis will include coronary artery disease, strokes, hypertension, claudication. I don't think I've left anything out. And the treatment of hypertension and the management of atherosclerosis will be the next topic that I will cover next.